Hello and welcome to this week's Medicare EmPower Hour, an hour designed to talk about everything Medicare that could be impacting you if you're agents or brokers, how to grow your business out there as you work in the Medicare space for Medicare Supplement, Medicare Advantage, and Part D products. We bring a wide variety of guests onto the show. My name is Erin Ackenheil, and this is brought to you by my company, Blackpoint Insurance, where we help Medicare beneficiaries learn about the A, B, C's, and D's of Medicare, and we help agents and brokers nationwide launch, grow, and retain their businesses. I am very excited to announce our special guest today. We have on the line, and I'll be introducing her in a moment, Shelly Siegel. Shelly owns Siegel Medicare Experts. She has a deep experience in everything Medicare, particularly in the compliance space. Shelly is very well connected to CMS, the Centers for Medicare and Medicaid Services, has a direct contact there who is helping to institute the new regulations around call recording, guidance around disclaimer language, everything that's coming out October 1st to impact January 1st, 2023 enrollments and beyond. This is a big change year for Medicare agents. We need to make sure we're ready. And there's been a ton of conflicting information, and we're so excited to have Shelly come join us today and get us all the up-to-the-minute information on everything going on in the Medicare space. So Shelly, welcome.
Thank you, Erin. It's great to be here. It's so exciting to work with you, and especially since we've known each other for many, many, many years.
Right? I mean, it's a small circle in the world of Medicare, right? You better be nice to each other because you're always going to see each other again, right?
Absolutely.
So Shelly, I wanted to let you know that we, first of all, have had a huge demand since your last time you came on the show talking about the new guidance coming in for 2023. So I really want to thank you for joining us previously. So much so that people were like, when is Shelly coming back again to give us the latest and greatest updates? So I really appreciate you joining us today. People are joining live as we speak. So I really want to encourage them, if you have a question live, you can put it into the chat box. I can bring it up on the screen, and Shelly will be addressing your questions live today. She's great on her feet, and she knows her stuff inside and out. So I know she'll just be a wonderful asset for all of us. Say hello to us and make sure that we can see you all out there. Oh, I got a hello. Okay, so we're live and people can see and hear us, so that's fantastic. So Shelly, let's jump in a little bit. I know, Shelly, you're going to give us an update on all the guidance and bring up a presentation in a few minutes. But before we jump right in, can you remind everybody why you're a subject matter expert in this space, a little bit about your background, and tell your story a little bit for my viewers?
Sure, I'd love to. Thank you. So I have actually been in the Medicare business industry for many, many years. I started actually in sales, telemarketing, and enrolling beneficiaries for the old days in Southern California for FHP, which was a lot of fun, telemarketing, and my green bars, dialing for dollars is what we used to call it. Now you can't do that anymore, but it was fun and really rewarding to be able to go out and talk to beneficiaries face to face in the kitchen, over the kitchen table, and help them decide what's best for them. And after doing that, I helped open a Medicare risk contract in the San Gabriel, which is wonderful because you get to, when you start a new plan, you get to learn everything from, typing up the ID cards to going out and doing a new member orientation. So you're really down deep, what we used to say, in the trenches, and helping the Medicare beneficiaries make the best of all their benefits and understanding this world, because it really is difficult for even us who have been in the business for 30 years to learn everything new, including like the new regulations. Long story short, I've been with health plans since all the way till 2004, and I've been consulting since 2004, which is wonderful because then I have the opportunity to meet new people and learn something new every day, and still work with CMS and all the regulations.
Right. Well, Shelley, I think what uniquely positions you and what makes you such a great partner for any company, carrier, agency, broker that needs help and support in this space is that you're uniquely positioned with all of those contacts at CMS and the deep experience in the space, particularly with compliance, sales and marketing, contracting, the whole 9 yards. But at the same time, you have been in the trenches, so you know what the agents and brokers are going through, and you can kind of translate that for us in simple, for me at least, I need it in a simple, understand manner so that I can implement and do a great job. So you're just such a great partner, Shelley, and we so appreciate having you on here to bring us up to speed. We have a lot of viewers saying hello to you, Shelley, so you're getting a lot of hellos, virtual high fives. People are saying hello to you. I want to encourage everybody, if you have a question live, go ahead and put it in the chat box and Shelley will address it. She'll be jumping into some of the information that I know you've submitted in advance that you're interested in. But if something needs clarification as we go, please don't hesitate to post a question. I'll bring it right up on the screen and Shelley is more than glad to answer those. So please want to encourage you to do that. So Shelley, one of the things that we're getting is a lot of conflicting information, right? So whenever CMS goes to implement something, I get the feeling that they think it's going to go a little easier than it does, right? Because there's so many cooks in the kitchen, right? Different carriers, different leaders, different perspectives, different guidance. We're getting a lot of conflicting information. I just saw something where one carrier said, oh, Zoom calls don't need to be recorded in writing out to all agents. And another said they absolutely need to be recorded. And so what do we listen to? How do we understand the mixed messages we're getting?
And CMS, they really are, they try their hardest to get things right and to make things not easy, but good for the beneficiaries. They don't try to make anything easy.
Easy is not necessarily the synonym I would think of.
No, but you got to remember, I'd say 95% of the people who work for both regional offices and central offices have never worked for a health plan, so, or a broker or an FMO. So they understand the book sense, but they don't understand the reality and how to implement and make things happen. So that's like these regulations. They basically wrote what they wanted to. They thought it'd be no problem because the scope of appointment has to be recorded, essentially if it's not, signed in person, and enrollments over the phone had to be recorded. So they're like, one more thing, no big deal. But boom, you put in these regulations and now they're like, what's the problem? Because they don't have that experience of how do you record it? When do you record it? Which do you record? Phone calls, Zoom calls, in the house, on the kitchen table? Do you bring cameras and say, okay, everybody, we're going to talk about benefits. Smile to the camera while we record this presentation.
I'm bringing my crew in for open enrollment to video all of this, right? So,
yeah.
So based on all this kind of chaos that's out there, Shelley, I mean, do you think there's going to be flexibility on implementing the guidance or some sort of flexibility in terms of how to operationalize this? What's your perspective on this? And, what gives you that feeling?
So bottom line, I don't think the regulations are going to change. They're, codified and they're there. And the intent, again, is there's a good intent to make sure that there's oversight and the beneficiaries are safe. So that is the intent. Now, how to implement it? I would say kudos to all the carriers and everybody else for raising the hand and saying, hold on, because of all the voices and the letters to CMS, I really think it's kind of, I was born in Hollywood, so I'll say now it's like a dress rehearsal. They're going to do a slow rollout, so you were not going to see, in my opinion, CMS doing secret shopping calls or going out to events. They're going to give everybody time to figure this out. How to record things, how to maintain things, and put together their policies and procedures, the scripts to make sure that everybody understands what to say, when to provide disclaimers, and when to provide disclosures. So now's the time to work on implementation, but not have to worry that in 18 days is D-Day, October 1st, and do I worry about, recording and how do I record it and not working on sales while I figure this out? The answer is no. You're there to help the beneficiaries start enrolling October 1st. It's a Saturday. And nothing like, all 7 days of work week. But now is the time to implement and try things out and work with everybody as an industry so that we can make things easier.
Gotcha, Shelley. So that's really comforting news. And I know you got that directly from CMS, from your contact. So I feel really good that we're going to be implementing 10-1. And I, for one, my company, Blackpoint through Van Bergen Associates, we've got a plan in place to record calls, to store calls, to do all of those things for our agents. But there's always that worry, like, what if something doesn't work and that kind of thing as we're implementing this. And it sounds like what you're saying is, yes, we have to put it in place, but we have a little room to grow and potentially make mistakes and test things out, a dress rehearsal, so to speak. Do I have that pretty well wired in?
Exactly. Number one is to help the beneficiaries and make sure that they get to be enrolled and be effective 1/1 or their appropriate effective date. But number two is to figure this out, to make it work for beneficiaries and for everyone so that we can document what we're doing and show CMS how well this process is and how we're helping beneficiaries totally understand the benefits, the responsibilities by the documents that we share, like the summary of benefits and the evidence and coverage, and the documents that carriers and FMOs create, because they're all constant and have the same language.
Perfect. So Shelley, what would you say to the agent that's listening right now and says, oh, great, there's a delay, I don't need to do anything? That's not the reaction CMS is looking for, is it? So tell us what your guidance is in terms of all of us out there that are saying, hey, we're muddling through it. This isn't a hall pass, is it?
No, this is not a stop, don't do anything. This is try something out, try different things out. Work with your system people like Sunfire and work with different recording to try to make it work. It's your way, as I said in Hollywood, this is the dress rehearsal. So you got take one. You don't want to do 30 takes. We need to make it work. And it'd be great to get more information and share with everyone what's working for each one. I know there's competition, but we're in the world to make it better for beneficiaries besides making money for us and making it better. It's got to be that give and take. So now's the time to work together and figure out what's best and how to make it easy and be able to record it. So CMS in the long word and carriers can basically then have the documentation to see how great this process is.
That's fantastic, Shelley. And what are you hearing directly from CMS? I mean, obviously they're saying we're going to be implementing, but we understand that there could be some challenges. What is your contact at CMS telling you? Are they surprised at the reaction? What kind of feedback are you getting directly from CMS?
They are surprised and shocked. And of course, there's all different types of views and issues. And, regional offices have one set of views, and central office that creates the regulations have another. They really are astounded at the feedback from everyone and how there's issues from Aetna and United and everybody speaking up. And so now that we're trying to work on putting something out to define everything in the next couple of weeks, but I don't believe anything's going to come out soon. And I do know that if there are questions, we can ask CMS the specific questions so that we can go forward. And this is the try it before you buy it timeline. So try things out. And if you have a question, you can send it to me or to Erin, and we'll work with CMS to see if we can publish those questions and answers one by one to see what the final answer is and how we can make it work. definitely willing to send your questions to CMS.
That is amazing, Shelly. And I hear, people are really liking that, right? So I'm going to encourage people to ask their questions here live. Shelly has a lot of answers. And what she's saying is that if she doesn't have the answers, she's going to take those questions directly to CMS, and we're going to publish them on my Facebook, on my LinkedIn, everywhere that I do business. You're going to see those answers, and I'm going to be alerting you to those. So Shelly is an amazing contact for us. Shelly, it looks like we have a question coming through. I just wanted to bring it up on the screen. It's from Irina. It says, what does the regulation say about contact with existing clients? Can you take that question?
Sure. I think if I'm interpreting that correct, it's if I'm going to call, I have a client, I enroll them, and I'm just going to call them to see how they are, and if they want to discuss new things. If the intent is to work with them, to sell them on something, that call should be recorded at this time. If you're calling just to talk about other things, to check in, to see how they're doing, to ask about referrals or other types of information, to make sure that they're going to the doctor or any other thing, that kind of conversation does not. But the minute you're trying to give them more information about other plans, then that basically is an intent to sell, and it would be recorded.
Got it.
Hopefully that answers the question.
I think it really does. And just to tag on to what you're saying there, Shelly, I think it's also, if that beneficiary is asking to review their doctors, a drug checkup to compare to other plans, that's a signal of recording. If they have a claims issue that you're following up on for them, or they want to give you a referral, probably doesn't need to be recorded, right? So just kind of putting it in some real-time examples to the team.
You got it. Perfect.
Look, Shelly, I can learn compliance. I'm good here. We've got it. So, so Shelly, what I thought now, as questions are still continuing to come through, I thought maybe you could just bring up your slides about the regulations, and what we could do is you could just take some time to remind everybody about what the guidance is, because what I'm hearing here is the guidance is not going away. We do need to implement 10.1. It's just not going to be aggressively regulated, let's say, as we get our feet wet and learn how to do it. But we still are expected to implement as of October 1st. So Shelly, I'm going to bring up your slide deck, and if you want to take it away.
Thank you. So again, this is from Siegel Medicare Experts. We do have a team that is able to help FMOs, brokers, agents, carriers with anything you need assistance with for Medicare Advantage and Part D. And essentially, we have a lot of different projects that we work with, including executive coaching, process reengineering, conflict resolution, training, one of my favorites, and working with EOCs and SBs and marketing and websites. So we do it all. So the regulations, and I know there's a question about the disclaimer, and I wanted to talk about that, and I will in a little bit. But essentially, these new regulations are effective October 1st in 18 days. And as we talked about, it's for effective date of 1/1/23. So that's why October 1st, you basically, if there's an age-in and you're enrolling somebody 10/1 because they're turning 65 on January 1st, then this regulation applies to that enrollment. But most of the enrollments would be for open enrollment, annual election period, that it's now called, starting October 15th. And it is to go ahead and use the right disclaimers and disclosures and to do the recording. It is so that everybody can document it. And I don't want to say it's a got you environment. This is the time to prove we know what we're doing. We're here to do the right thing. If you think about it, I know this is kind of a weird type of example, but sometimes, a husband and wife, you kind of complain to everybody's relatives when you're in a fight. And so everybody has this opinion that all you do is fight. But the reality is when something's going right, it's not shared. So this is our way to share to CMS, and the way to look at it, to share all the good things. not just what we're fighting about or what beneficiaries misunderstand. This is the time to prove we know what we're doing and we will be doing it exactly. CMS and the regulations changed a little bit of the definition of what an FTE is or FMO. And so basically third-party marketing organizations include independent agents and brokers. Some people didn't think that that was included because they're not, agents and brokers were not part of a FMO, but essentially anybody who sells or is in the chain of enrollment is involved and impacted by this new regulation. So this actually shared with CMS this table to say, is this what you're talking about in the regulations? Is this a correct picture? And CMS looked at it and said, exactly, this is what we're talking about. Even if you don't have a contract with someone, because they're touched that enrollment from either generating the sale, generating the lead, doing advertisements on the TV, then they basically are part of the chain of enrollment and have to use these regulations to make things clear to the beneficiaries. So this oversight is for MAOs, Medicare Advantage organizations, that everybody adheres to the regulations and requirements, disclose what's required, and record all calls in their entirety, as we've been talking about, and use the disclaimer as required. I know disclaimers kind of seem odd, but essentially a disclaimer in the material that, like the EOC, doesn't need to be in black and white at the bottom. The best way to use disclaimers is to just talk about it, and we'll go through some ways to do that. But right now,
Shelley, I was going to just interject for a second, because a lot of agents, in fact, we just got a comment just how the disclaimer is so frustrating to them, right? Because it can make for a very awkward conversation, right? You think of those commercials where they talk really fast at the end and they try to zip it all in. What is your advice? I know you're going to share some best practices, but is there a way to integrate the disclaimers into the conversation and create a smooth sailing and not an awkward conversation between beneficiary and agent?
It is a great question. And it's not CMS intention that everybody in the first minute of the call has to say, first, I have to give you a disclaimer. Quote, we do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-Medicare to get information on all your options. That is not the intention. Again, the intention is to educate so that if somebody's calling in, they understand completely what you have to talk about and what you have knowledge on and expertise on. So the more that and somebody used to say to me, the more that you put the disclaimers into the material, the less you have to put it on the bottom material and make it look like a legal document. So when you're talking to somebody in the first minute and say, hi, thank you, Erin, so much for talking with me today. I just want to tell you that what I'm going to go through is the plans that we offer in your service area. So since I have your zip code, I know the plans available, but unfortunately, I don't work with all the plans. So if you do want more information, I wanted to let you know you can always call or contact Medicare.gov. There's an 800 line where you can get the information, and they can provide all the options. I'm here to give you the information on the plans that I work with that I know you're going to benefit the most out of, and go on. So essentially, it's a conversation. It's not a quote unquote disclaimer, or as Erin said, in the commercials where they said this commercial is provided blah 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 blah.
Right, and just what you just did there, Shelley, sounded fine to me. I felt very comfortable in that conversation, and I felt like I would have just felt comfortable moving forward, kind of knowing the truth of the matter, but ready to work with you and connect with you. So I know it's new language, agents out there. I know change is difficult, but if you integrate some of the strategies that Shelly's talking about and just making it part of the conversation, I assure you, it'll become normal protocol. And you answer these questions every day anyway, because people will say, do you represent this plan or that plan? And you're already saying it. I don't work with everyone. Now it's just more official, and you'll just have to learn to integrate it in words that work for you, right? So kind of doing that and keeping it comfortable. So Shelly, that's just great feedback and help to create a comfortable situation.
And then, you know, as Erin said, you usually answer that question anyway. Now you're just moving the answer to the question you're going to get at the beginning of the sales call, so that up front, the beneficiary knows exactly what you're going to talk about.
Perfect. And Shelly, do you recommend that on our email correspondence, we put this disclaimer at the bottom of our emails? Is that a good idea?
I think that's an excellent idea. You know, so the more that you have it anywhere on the websites, in materials, in television ads, out on envelopes, the more it's out there, the better communication. You know what they say, over communication is great communication, because then you're sure they're going to get the message. Sometimes people believe you have to say it at least 3 times. Thank God Sam does not say, go ahead and say this 3 times like they do in Wizard of Oz, click your heels together and say, there's no place like home. This
Exactly.
is basically, you're just saying at the beginning, you're one and done.
Perfect. Shelly, just for a moment here, I want to remind everybody that we are live. So if you have questions, you can post them right in the chat box. Say hello to Shelly, say hello to me. You can like us, but if you have a question, don't hesitate to put it in the chat box, and I'll be sure to bring it up on the screen for you. So go ahead, Shelly.
Thank you. So there are also disclosures, and so when you're conducting lead activities, then essentially you have to disclose to the beneficiary that their information will be provided to a licensed agent for future contracts. And that communication needs to happen, as Erin was just talking about, in writing with communication, or verbally, electronically, or if they're going to be just, they're in the old days, you couldn't transfer somebody to enroll. They had to be an outbound call, inbound call, you know, whether it's dial a friend. But now essentially you can transfer somebody to enroll. You just have to let them know that they're being transferred to a licensed agent who can enroll them in their new plan. So I think CMS made that easier, so you don't have to tell beneficiaries that you worked with, okay, I gave you all the great information, I'm glad you want to enroll. Now you have to hang up and call back into this number to enroll over the phone. Now you can transfer calls and essentially just let somebody know they're being transferred to a licensed agent who can help them enroll into the new plan.
That's a great improvement.
So just essentially, knowledge is having the right answer, intelligent is asking the right question, which is why we're saying if you have questions, you know, Erin and I are 2 people, but there are so many people working in this industry. The more questions we get, the more questions we can clarify with CMS, the easier it will be for everyone to go through and learn about what was the intent of this and how can we make it happen and make it easier. I think that is the presentation.
Thank you so much, Shelly. So I'm going to come back to us here. There we are. So welcome back. So thanks for updating everybody. So essentially, you know, in terms of guidance, all the calls need to be recorded. I know a lot of partners, like for instance, Van Berg, who I work with, is going to be using a recording mechanism through Sunfire Matrix, which is our enrollment tool. That's going to be available for our agents. We're working on storage solutions and implementation. What are you hearing out there in terms of other partners, carriers? How are they planning to implement that? Are they using systems like Sunfire? Are they doing other things? Are there any best practices that you could kind of share with the broader audience?
I think that's one thing that we need to do in the dress rehearsal when we're practicing. I hear a lot of people are using Google Live to record, and also a lot of people are using different systems so that agents can just record on their Android or iPhone. There's about 5 other systems that people are using. I haven't used any, so I'm not going to go ahead and say I'm getting money for this one, so refer a friend and use this system. But if you just Google how to record on my iPhone or my Android, there are 5 systems that always come up, and some of them are free. So you can try them out, and now that CMS is kind of saying, let's see what works, you can try different systems and see which has the best process and is easiest for you.
Yeah, that's really great feedback, Shelley. And one thing I can say is if you're out there and you're working with a national marketing organization or a field marketing organization, just like our agency, they are probably providing you a tool that you can use for call recording. So if you haven't gotten information on that and you need it, be sure to reach out to your upline to get more details on how to implement all of this on October 1st. The disclaimer's on you. You need to incorporate that as part of your sales process. It's going to be recorded, adding it to your email signature, those types of things. That's going to be an individual decision. But I know a lot of people that listen and follow me out there don't work with an upline partner. You're on your own independently. You can continue to do that if you want to. Just like Shelley said, there's several things differently on mine that you can use. But this might be a good time to think about working with an upline partner that can help you and support you in this process. So again, this is the dress rehearsal, but if you find that it's difficult for you, I just want you to know that there is support and help available to you. Now, Shelley, it looks like we got a question coming through, so I'm going to bring it up onto the screen for you. Do you want to take this one?
Sure. So the question is, what if a client says they do not want to be recorded? And essentially, if someone doesn't want to be recorded, we got to work on with CMS, what do they want us to do? But I really think that the more that you explain it, I personally have never had in 30 years somebody say, I don't want to be recorded. Either, in customer service, when people call in, there's always the recording at the beginning that says, this call will be recorded for quality purposes. And in customer service, I've never heard someone say, do not record this call. I'm only one person. I'm sure it's happened. But I think the best thing to say then is it is a requirement from the government to record these calls. And if you don't want me to record it, let me send you information and then you can look it over and please call me back. So that is one way. Erin, what do you think?
Well, I think that's good feedback, Shelley. I feel like we've heard some mixed results about the fact that, some clients are going to say they don't want to be recorded. What I fear is that's going to be, I'm an agent, right? I understand what it is to have the behavior out there. This isn't an avenue to try to get out of recording the calls, right? And I'm not suggesting that the person who asked the question was saying that at all. But I think sometimes we're looking for a way out, let's face it. How do we get around the guidance? And so clients being not interested in being recording would be an easy potential way out. I agree with Shelley that that's going to be the exception versus the norm. I will say, Shelley, there's always that one unusual person that doesn't want it, and we got to cross that bridge when we come to it. But I think for the most part, people will understand that CMS, for better or for worse, they're implementing this guidance for the protection of the beneficiaries. So when I run into things where people are like, why do I have to sign a scope of appointment? Or why do you have to do this or that? Usually my answer to a question like that is CMS is putting these guidelines in place to protect you, to make sure that you're getting the information you need, what you want, and to make sure that all the agents that work in this space are doing so in a compliant manner. I will say my experience is that's usually enough to get people to say, okay. Now, for those exceptions versus the rule, I think we'll wait on guidance from CMS. But what I just fear is that agents might try to use that as one way to just not have to implement this. And I don't think we're going to get around implementing it one way or the other, but we have this opportunity to test out what works, and as we see these experiences, kind of deal with them and figure out the best practices as an industry.
Great answer. Thank you. I really think there are always people who are going to say no. And the more that you joke with them and make them understand that education is at key. Okay, this is your commercial and it's time to make you famous. So I want to show exactly what you say, and I want to make sure I understand your question. So we're going to record it. So I understand exactly, did I answer the right question, or is it something else that I need to say, just to help me make it better and make it easier, because this stuff is not easy.
Right. Well, and I also think, Shelly, it's not like they can go to someone else who doesn't have to record it, right? So there's not really an alternative. It's kind of like you say when you call up a customer service and it says, this may be recorded for quality and training purposes. If you want to do business with them, you get recorded, and that's kind of how it works. And so that's going to be the way it is, because I'm getting additional feedback. There's a lot of folks that don't want to be recorded. And I kind of can understand when someone comes to me and says, do you want to be recorded? I'd be kind of, no, not really. Just, let's just talk. But if they understand that it's a requirement and there's nothing we can really do about it, and it's part of the process and it's really there to protect them, it's going to be our job to educate them and move the industry along to get comfortable with this. It's a tough one, right? It's new things, and change is hard. It's hard for me too, but I think we'll get through it as long as we're consistent as an industry and work together on getting this implemented.
Yeah, it's all about the attitude to make sure we're actually telling everyone why we're doing it. It's not because we're looking to play it over, or we really want to show, the truth is we want to show CMS that we're out there to help the beneficiary. They're hearing complaints. CMS is hearing complaints that they're bad agents and people who don't know what they're doing, and people who, are enrolling beneficiaries into the wrong plans and telling them to disenroll and enroll in another plan. This is our opportunity to have recordings to prove to CMS that we know we're doing a good job. We're giving the beneficiary all the information they need. It just sometimes beneficiaries won't remember, because, I don't remember what I had for lunch yesterday. It's a part of the business. I remember in selling in the old days, or even, there's sales allegations, and essentially, everybody was so scared when they got sales allegations and felt so bad. But if you're selling, you're going to get sales allegations, because we're working with a population that sometimes doesn't understand or doesn't hear what we're saying, or gets confused because there's so much information. So this is the way that we, in black and white, can prove to CMS we're doing the right thing.
Right. I feel like it's a way to sell ourselves to the beneficiary too. They put this in place to protect you. I'm happy they're doing it to protect you. I was always doing this good work, and now it gets demonstrated. So Shelly, we had a question come through. I thought I'd bring it up on the screen. Do you want to take this?
Is CMS, let's see, are you going to record me taking this? Is CMS looking to actually cut the fat from agents that are purposely not doing the right thing? I think I can speak for a lot of us when I say that we know some agents are enrolling people without their consent. CMS wants to make sure that agents and brokers and everyone selling, even the television commercials, are doing the right thing. They're saying the right thing. And so this is a way to actually get facts and know the truth, black and white. Is this good or not? We really need to, this is our chance to evidence compliance and our chance to make a difference in each beneficiary's life, to make it easier so they do understand what's best for them. And I think that's what it's all about.
I totally agree. And I actually think that it will have the effect of cutting the fat. If people are operating in a non-compliant manner, they'll be terminated contracts and relationships if they're not doing it, or Big Brother's watching, right? You know, someone's watching you, it'll turn behavior around and right size the business so that people are all doing things ethically the right way, like 90% of us are already, right? And so let's see, another question came through as a bit of a follow-up to that question.
So perhaps giving penalties or terminations, you know, part of the regulations now also includes that any terminations have to be provided and reported to health plans. And yes, I think it's a way to, you know, you can look at this with the glass half empty or half full. You know, oh my God, Big Brother's watching you. The movies were all right. Now we're down to that point. But essentially, we really want everybody to do the right job. We want people to tell the beneficiaries the right things. We want people who are saying just disenroll or call CMS. Call when they get in Medicare and tell them you wanted to disenroll because you were enrolled in error when it wasn't even true, you know, because I want to enroll you in my plan. We want everyone to do the right thing and make it easy for the beneficiary, or at least a little bit easier. So I think it is more important to give the right information and do the right thing. And if there are agents doing the not right thing, then we need to work on that together.
Right. You know, it's so funny, Shelley, because I've had a long history in management, right? And now running my own business and having a team and so forth. And I think it's human nature to think of regulations and guidance and monitoring as punitive, right? Especially when it's new. It just feels really punitive and doesn't feel good, right? But in my career, most often when we've done oversight and regulations and guidance, it's really to over 90% of the time catch people doing something right, to compliment their efforts, to thank them for what they're doing, to demonstrate what a great job we're doing as an industry. So sure, it's going to weed out the 10%, the negative, the wrongdoers, but it's also going to highlight the credibility we have as industry and leaders in this space and doing good work out there. So usually guidance and goals and different expectations means that once you achieve those, you've got that relative level of success and people see that you're doing good work out there. So it's going to give a lot of credibility to our industry. And I think that's a good thing. We do really good work. It takes a special group of people to do what we do. Patients, education, training, guidance. There's so much out there, and we work really hard to be Medicare agents, and we want our business protected and our industry protected. And without this kind of regulation, we might not have a protected industry for the long run for our businesses. So in a way, it comes full circle and is really actually good for us, right? So take a spoonful of sugar with the guidance, because it really is going to help us as an industry in the long run.
You know, they say it's a great point, because, you know, when I was managing a group of salespeople, you know, people would come and say, this person's really not doing a good job. And now, you know, I had to go in and really help somebody understand it's always one bad apple that ruins the whole bunch. And so we really want to prove to everyone, we know what we're doing the right thing, and we don't want one bad apple or 10% to do the wrong thing and make people think that we're all bad, because that's the first thought of people. Oh, don't talk to an agent or a broker. No, I've had several different neighbors come over and say, help me understand this. I heard also that I can't talk to a broker because they're just doing this for the money. And no, there are brokers and agents that are good. There are brokers and agents that want to do the right thing. And so I think this will help everyone get a better feeling about what brokers and agents, because there are people who basically say, my broker is great. They know so much. Let me give you the name and number so you can call them, because they really help me decide. And that's what this will help with.
I 100% agree, Shelley. So we're getting close to wrapping here. So I want everybody to continue to give likes and love to Shelley. I know, Shelley, a lot of people are going to be watching in the replay. So let's say hello to all the people who watch us later in the replay. Want to encourage everybody to continue to ask questions. I'll address them as they come through on the LinkedIn and Facebook Facebook and YouTube and wherever they come. And of course, when it goes beyond my expertise, I'll be bringing Shelly in. And if she doesn't know the answer, she's going directly to her contact at CMS. So we've got the first line of defense here, up to the minute information. Shelly, before we wrap and talk about how people can get in touch with you other than through these social media channels, can you just remind everybody what is really meant by a soft rollout for open enrollment? It doesn't mean that the guidance is going away, but what will a soft rollout do for all the agents that are listening in on this call?
So a soft rollout, I like to think about it in when there's a new restaurant and they have, you know, a soft rollout for the restaurant. It's like they don't really advertise that it's open, but it's a chance for people to come in, relatives, others, so that they can make mistakes and not have it advertised. You know, they can try things to see what works and what doesn't work. And so this is what we need to do as well. We need to do the right thing, put the regulations in place that we can, and try different phone recordings, try working with the industry to see, is there a way that we could get on the same page? For instance, is there an attestation that we can create for everyone to sign so CMS can see that we all understand exactly the requirements? What can we do at educational events? What can we do at sales events? What do we need to make sure we're telling the beneficiary? And if everybody signs that, we can show CMS everybody has this information. So that's kind of like trying it before you buy it, or buying it before you try it, is to try it out, try different things. And when something works, let's help each other out. So the ultimate goal is we can help the beneficiaries out, and we can make sure everybody understands that we're here to do the right thing.
Shelly, you're amazing. Your knowledge is phenomenal. Your leadership in the industry, bringing carriers together, connecting directly with CMS is really unprecedented from the groups of people that I know and I'm connected with. So I just really always appreciate your collaboration, your broad perspective. You're incredible. Can you remind everybody how to get in touch with you if they have questions, or certainly they can go, if you have a question, you can go to my LinkedIn and add a comment or question to this. You can private message me. You can do it on Facebook. You can do it on YouTube. I don't know how many ways we can give you. You can email me, you can call me. But Shelly, if people want to reach you directly to ask a question or to perhaps get some consulting services from Siegel Medicare experts, what's the best way to get in touch?
Definitely just give me a call. I'm here to help. So my cell number is 562-334-7980. I'm located in Southern California in Signal Hill, right by the Long Beach Airport. And essentially call me anytime. And if I can't help you, essentially I'll find somebody who can answer your question and help. You know, Siegel Medicare Experts, we have a website. You can look at our website to see the different information and how we can help you. We have a team of experts. I'm not in this by myself. It always takes a team to get things done. And we have a great team, from people from Rhode Island to Hawaii, ready to help you with whatever you need, whether it's creating the compliance program or putting together call scripts or doing training so everybody has the right information. So give me a call. I'm here to help.
Shelly, I so appreciate your partnership. Thank you again for rejoining us. You were excellent. For everyone in the replay, be sure to ask your additional questions. I will get them directed to Shelly and her team of experts. Really, really appreciate your time, Shelly. Have a fantastic day and happy open enrollment to you. See you soon.
18 days and counting. Good luck.
For everybody who's counting, right? Thanks, Shelly.
Yeah.